You can't see anything. I've done it now, so the audio is going to play through my phone.
So if I put what do I do? Put my extension number in?
No, it came up with a link for me. Press that button there. Use phone for audio.
Yeah.
Then it gives you a.
Hello and welcome to everybody to this, our first Greater Manchester Primary Care and Community Nurse Forum. My name is Leslie Royal Pryor and I am the Primary and Community Nurse Lead for Greater Manchester. I'm really excited and possibly a little overwhelmed at the amazing response we've had to the call for support for this forum. Today we have nearly 300 colleagues joining us from across primary and community teams in Greater Manchester. I think we're waiting for some more to come in at the moment. We've got an excellent agenda with guest speakers eager to share latest developments and best practice from across Greater Manchester, the North West and nationally. We hope this regular forum will not only become a platform to showcase the best of nursing in Greater Manchester, but will keep you connected, informed, updated and inspired. So thank you once again to all of you for joining us today. Sit back, enjoy the forum. Please keep your cameras off and your microphones muted. And if you have any questions during the meeting, please place them in the chat box. Thank you. If we can have the next slide, please, Karen. And the next one. So I'm pleased to introduce our first speaker, who is Jenny Wilborn. And she is the clinical team leader from the Greater Manchester Resilience Hub. Thank you, Jenny.
Hi, thank you everybody and thank you for inviting us to speak today. We just wanted to give everybody a bit of an overview of the current offer that's around in Greater Manchester. This has been set up also in line with the national offers in terms of supporting staff wellbeing in what are incredibly difficult times at the moment. So just a bit of a background to us at the Hub. We're a service. We were set up after the Manchester Arena attack to provide psychological support to both the public and the professionals that were impacted by the attack. So for that piece of work, that was national because people attended our arena from across the country. We've got about 4,000 people open to us, both public and professionals of all ages, and so that work's ongoing. And obviously with the inquiry running at the moment in Manchester, that's a really important piece of work, and it may be that that's something that people want to pick up outside of this meeting as well with us in terms of people that you know and colleagues that might be impacted still. So in terms of the Hub, we are a multidisciplinary mental health team. We're staffed by psychologists and clinicians and therapists. And when obviously COVID hit, there was a real recognition in Greater Manchester that actually those people working, particularly in health and social care, were actually dealing with some really difficult and challenging situations with redeployment, with the challenges in the community and on the wards, and with everything else that COVID has just brought to our personal lives, which are then interplaying with our work lives. So Greater Manchester and the Health and Social Care Partnership were very keen for us to think about what we could do to support the offers that were already out there in the workplaces. So on the back of that, NHS England also produced a national response. So there are national helplines and national offers, and they're now facilitating the setup of hubs similar to us across the country. So we're ahead of the curve in Manchester, but that doesn't mean we don't need your feedback and we haven't got a lot of learning to do as well. Now, and we're also involved in what's called trauma across Greater Manchester too. So you may find us popping up in other arenas as well. So yeah, can I have the next slide, please? Brilliant, thank you. So I guess one of the things that we wanted to just share with you was some of our learning from the arena. So Our arena service was based on learning from other mass incidents, and then we've been in a privileged position to think about what we've learned from our experiences. And I guess one of the key factors is that psychological support and well-being should be everybody's business, that actually it doesn't matter who you are, you should be entitled to support, and you should be within a system that means that that's okay to access that sort of support. And we had a lot of people with the arena who felt that because they weren't physically injured, that actually they weren't deserving of support, and that's a really important myth that we need to be dispelling. I think the other thing that we learned was that about supporting people in their context, and we know this particularly with COVID, and with everything that we're all dealing with personally and all our clients are dealing with, that actually there's lots that can be done to scaffold a person and a family system that's just as vital and important as a mental health intervention. And actually, if we can get some of that right, then we may go a long way to helping people when they're feeling really overwhelmed. One of our other bits of learning was that we know what's called the recovery phase is when the uptake is best for support. So that works really well for a critical incident because the incident happens and then we move into the recovery phase shortly afterwards. In terms of what we're currently dealing with, that's really murky waters. So we're not really in a recovery phase. We are currently still working and living with COVID, which means that actually our natural resilience that tends to kick in when difficult situations are over is really stretched. And so we know that you guys and your colleagues and lots of other people in the system are having to gear up again when actually you've not really had a chance to have some downtime from the first wave that we were dealing with. We also know, which is partly why we're coming to your forum, partly why we're doing lots of other work, that in health and care, we are probably some of the worst people for reaching out for our own help. We're very skilled and we're very committed to supporting those that we care for, whether that be our family or whether that be our clients and our patients. But we do know that in terms of meeting our own needs, we're possibly not as great at that. We're more inclined to work long shifts and not take our breaks than we are to look after ourselves. But actually, if we're going to survive this and if we're going to be at our best to help our clients and patients, we really need to invest in ourselves. So it's really important that we embed that across our teams and across our culture. And that's why it says on the slide about proactive outreach, because what we mean by that is getting the messages out there on the ground that actually it's okay not to be okay at the moment. It's a really, really difficult time. It is going to be overwhelming, and actually seeking support doesn't mean that you're not coping. It means that you're human and that you're perfectly entitled to it. Can I have the next slide, please? Thank you. So as I said, the difficult times we've got at the moment is that the threat and uncertainty is ongoing, which means that we are going to find as a workforce that we're dealing with increased challenges, and we're dealing with clients and patients who are more distressed, we're dealing with colleagues who are more distressed, and we're dealing with systems that are really stretched. And we're also then having to do all that at home again. One of the other things though that we do know from ourselves and from the national helplines is that actually, even though we know staff are underreporting, there is a lot of evidence out there, whether it be anecdotally from our calls or from the research, that actually people are genuinely struggling. And maybe people wouldn't be struggling if we were in different times, but we're not. We're in these times now. So we know that at least 60% of the people that are coming through to us are scoring for trauma and anxiety and low mood because things are just really tough at the moment. And can I have the next slide, please? Thank you. So I guess in terms of our current offer, so the arena offer still stands. If you go onto our website, you can self-refer for support for the arena. So again, it's not that that's finished, it's just that this is running alongside it. So our current offer is for all health and care staff and their families who live or work in Greater Manchester. That's everybody from your student nurses right up to your senior managers, from your ward clerks and domestics to your nurses and nursing assistants and everybody else in between. And we're really keen to offer something that complements your workplace offers. So it's not about coming in and telling people how to do it. It's about very much helping people think about how they might enhance what they're already doing and how we can prop up the system when actually it's really stretched at the moment. We have links into the local offers, so that could be everything from financial advice to bereavement support, and we have links into everybody's workplace offers, and we also have links into the national offers as well as our own offer as well. But again, what we're doing at the moment is working with teams and with HR systems to try and think about, in your area, what can we do to help. Can I have the next slide, please? Brilliant. So this is just some of our offer. So we offer webinars and workshops, we offer training, we offer facilitated peer support groups. So sometimes whole teams are taking that up, which is just a safe space to stop and think about what you might do differently and how you might focus on your own self-care. We offer consultation to managers, and then I'll just talk in a bit more detail about the screening, because that's possibly where we can really help the system out. Can I have the next slide, please? So some of the resources that you see there, they're all on our website, and some of them have also been developed from the Arena attack as well. So they're all on the website too. So in terms of the referral process, one of the other things that we offer is the clinical bit of the system, which means that we can support people to really think about what might be going on for them and then give them the level of support they require. So people can refer in really easily. We have an electronic link on a web portal on our website. However, you can just pick up the phone or email us and we will do our best to help you. The reason that we like people using the electronic portal where possible is that it actually has some questionnaires on it about anxiety, low mood, trauma, what might be going on at the moment. And that means that in the background, before we speak to you, we can make sure we match you with the right staff member, and we can also make sure that we prioritise people that need to be responded to quickly. But saying that, anybody can access us at any time. We don't want that to stop people accessing us. And we're happy to take referrals from managers with the consent of the staff member. But if you're a manager and you haven't got the staff member's consent and you just want to think about more generally what you might be doing, then that's fine. We can give you advice and support too. And I think the other important thing to say is we've got staff from the 3 main mental health trusts. So if you're working within MFT, GMMH or Pennine, you can request to speak to somebody who's not from your trust. And we have an internal policy that means if you know some of the people that work at the hub, we can make sure that they don't look at your notes and that they don't have anything to do with your care. Next slide, please. So this is on our website. Please click on and have a look. This is one of our lovely colleagues, Viv, just explaining the screening process. And that's one of our quotes from Barbara from Manchester, who's used our service. Again, if you do use the service in any shape or form, we're always really interested in your feedback. We want to shape it with our colleagues, not in isolation. And any feedback is always, or any quotes like that are always really gratefully received. Next slide, please. Brilliant. So I've been through some of this. I guess the other thing I wanted to say about the self-referral process as well is that at the end of it, we can offer whatever you need. So that could just be a conversation to reassure you that you're doing really well. It could be helping you reach out to relevant services and navigate what is a really complex system in terms of getting help for yourself. It could be speaking to one of your family members if they want to refer themselves in. We can support them. It could be talking to you about children. But also it can be more detailed than that. So if actually you are really struggling with sleep or low mood or anxiety or trauma or anything, then we have qualified clinicians that can really help you through that. And if at the end of that, it's helpful to have a referral into therapy, then we can support you with that and make sure you get to the right place at the right time and really understand what you're signing up for. And we make sure that happens for you. Next slide, please. Brilliant. So this at the beginning. This is the facilitated peer support offer. This means that you can come together as people in the same role or with your teams to have a think about what's going on. There is a national offer that means that you can meet with people across the country in the same role to you. So this doesn't exclude you from accessing the national offer. But again, really interested to think with teams or people in a similar work role to think about how they can come together to really support each other. Next. But here's our please do get it. Thank you.
Thank you, Jenny, for that really important update there. Have we got any questions in the chat box there that Jenny can answer before we move on?
No, Leslie, there's no questions.
That's great. Thanks, Jenny. Can I just ask everybody before we move on, if you could mute your mic, please? We're getting some feedback, so it's quite noisy here. So if everybody could just mute their mic for us, that'd be great. Thank you. Right, Karen. So our next speaker is Sarah Jones from Greater Manchester Screening and Immunisation Team. So I'll let Sarah take the stage now. Thank you, Sarah.
Hi, thank you very much. Thank you for having me come on to speak today. So I'm going to just cover two topics, the seasonal flu programme, which a lot of you are right in the middle of at the moment, and also the cervical screening programme. If you do have any questions as we go along, please just pop them in the chat and I'll try my best to answer it. But if there's anything we're not able to answer today, then you can always email our inquiry line email address, which I will talk about as well. Okay, can I have the first slide, please? Okay, so I've purposefully made these slides a little bit vague because flu changes so quickly, and it has changed already since I made these slides, so I'm glad I didn't put a lot of detail on. So firstly, we'd just like to say thank you to all of you for such a brilliant start to the flu season. We know there's a lot of innovation happening across Greater Manchester, people having to do flu clinics in totally new ways, working together across PCNs or CCG footprints. There's loads of really good stuff going on. And this year, the flu programme is bigger than ever. We've got vaccines being delivered in primary care, pharmacy, maternity, hospital trusts, drug and alcohol services, homeless services, and of course the schools programme. So there really is a lot going on at the moment. We know there's issues across the country with supply and demand of the vaccines, with some practices getting staggered deliveries. So some practices have maybe run out and are waiting for the next orders, and that's quite a common thing. We have got assurance that across the season there will be enough vaccine for all the at-risk people who would like one, but it's just all not available now. So some people may have to wait until a little bit later in the season before they can access that. So there is a leaflet that I will pop the link to in the chat that you can use with patients who, if you've got a bit of a gap in your vaccine supply, where you can give them the leaflet to kind of explain why and to reassure them that it's okay if they need to wait until November. We know that there's some issues with the informed data being uploaded, but anecdotally we know that pharmacies and general practice have seen a massive increase in demand in September, and we're way ahead where we normally are at this time in the year. So details of how to access additional stock for if you've run out for your at-risk or your over 65 patients, or for any of the extended groups. Details of how to access that stock have been circulated to primary care, so your practice managers should have that information. If you work for a trust who need more vaccines, then that will be the information on that will be circulated shortly. And make sure you're prioritising your very vulnerable people, such as your care home residents, if you are running low on stock. And don't forget the 2s and 3s. The vaccine supply for that cohort is absolutely fine. There's no issues with it. So if you have got a gap in supply, then that's a really good opportunity to target your 2 and 3-year-olds. So as you'll know, there's been an extended offer this year to household contacts of shielded patients, which is a bit of a hard one because we don't really know how many of those that there are. And also the Year 7 children through the schools programme. So that's been delivered by IntraHealth in Greater Manchester. There's also the extension to the 50 to 64-year-olds, which we'll talk about in a little while, but that's not been confirmed yet. That's definitely going ahead, so we're still waiting national guidance on that cohort. There's been a national call and recall service put into place to invite people for the vaccine. So this is on top of the kind of contractual obligations that practices normally do themselves. So letters have gone out nationally for 2 and 3-year-olds and school children. They may be sending some letters to at-risk patients, but that's going to be a little bit later on in the season once they've got a good idea of who's already had one. One aspect of flu that we're having a few issues with is cold chain management. We've seen quite a few incidents where vaccines have been left out of the fridge. So this is quite common if there's a big practice that's in a healthcare centre with lots of other services, and maybe your reception's not staffed because of COVID and all sorts of issues, and then the vaccines haven't been put in the fridge. There's also incidents where there's power cuts or fridge failures, which you can't mitigate against really. If there's a power cut, there's not a lot you can do. But please check your cold chain policy and make sure that it's up to date and that you have contingency plans and that everyone working in your building knows what to do if you get vaccine delivery, because the last thing we want is all your vaccines being wasted and it being quite hard to replace them. Okay, can I have the next slide, please? So these are some key things that we get through on our inquiry line all the time. So just to remind you really, healthy school children should always be referred back to IntraHealth, and that's the number for IntraHealth. You can give that to parents, and if parents contact them, then they will arrange for them to be invited to a community clinic. If a child is at risk, then they can also be seen by yourselves in primary care, and you can order the vaccine for that from Inform. So healthy children go back to IntraHealth. At-risk children can be done by either IntraHealth or the GP. Children who turn 4 during the season remain the GP's responsibility. So the criteria for the 2s and 3s programme is any children who turn 2 or 3 on the 31st of who are 2 and 3, sorry, on the 31st of August. So if someone turns 4 in September, they still remain the GP's responsibility. So just be aware of that, because that does catch some people out. In terms of porcine gelatin refusals, which is a big issue in some of the areas in Greater Manchester, the policy's changed this year. So previously, if a child was at risk and they refused the porcine gelatin, then they could access the injectable as an alternative, but healthy children weren't able to have that. The policy has changed this year, and at-risk children can be given the QIV from Inform or QIVC, depending on how old they are. Healthy children will be able to access the injectable, but it's dependent on vaccine supply. So again, we're waiting for further confirmation and guidance on the stocks for that and how that can be ordered. So there will be information circulated, and it will probably also be on the Inform website for when people can access that. And for school children, IntraHealth will be offering that to people who decline. As I've said, 50 to 64-year-olds, we're still waiting for further confirmation. If they are confirmed, then the vaccine supply will be available to order from the national stocks that have been confirmed. So the vaccine supply will be there for them if that cohort is confirmed. But if you're not sure about anything, you can always email us. A lot of you, I've seen the people who are attending today and recognise a lot of your names that you already contact us, which is great. Please just drop us an email and we can clarify any questions that you have. We also have a new website, which is GM Primary Care. I've just popped that on there. That's got all the guidance, all the national and local guidance on there for people to access. So next slide, please. As I said, you can always contact us with any queries. However, these 2 documents are absolutely invaluable. it's the national kind of frequently asked questions for both the adult and the childhood programmes, and they do have the vast majority of the questions that people ask us are covered in these documents. So if you don't want to wait for us to respond to you, then this is the best place for you to look, and the links are there. But if you just Google the National Flu Programme, then you'll be able to find them online. Really good if you just bookmark them. They do have a lot of information in there that will cover quite a lot of your questions. Shall I just stop there and see if there's any questions on flu before we move on to cervical screening?
Hi, Sarah. Yes, we've got a few questions on flu.
Yeah, thought there would be.
So one of the questions is, let me just bring these up. Do we know when the vaccines will be delivered for the 50 to 64-year-olds?
So the national stock, which will be for that cohort if it's confirmed, will be available from November. So details of how to order that stock have gone to primary care. So in the first instance, you can use that national stock for the existing groups. So for your at risk, your over 65s, anyone that falls into those groups, and then if the 50 to 64-year-old cohort is announced and confirmed, then we will then that will be where you order the stocks from as well for that cohort.
Okay, the next question is from Leanne. How do we vaccinate staff? What things need to be in place?
If you mean staff as in each other, then you need a peer-to-peer, I can't remember what it's called, but there's a really good website, the SPS website, that has frequently asked questions on vaccinating healthcare staff, so staff in trusts and GP staff. I'll pop that in the chat, which does answer most of the questions about that.
Also, Leanne has asked, do the CCG fund staff having the flu vaccines?
Not that I'm aware of. I think the practice staff is the responsibility of their employer, so the GP would be responsible for sourcing and vaccinating their own staff.
Okay, the next question's from Jacqueline Norman, and she asks, are school nurses doing injectable vaccines for those not wanting nasal for any reason?
Yes, the school programme will be, they are currently collecting all the consent forms. On the consent form for the school programme, there's a box that you can tick to say that you're refusing the nasal spray. They'll be contacting children later in the season to offer the injectable where possible.
Okay, the next one is from Julie Holden. What's the procedure for learning disabilities over 18s to perhaps give nasal flu?
Yeah, so the nasal flu spray isn't licensed in over 18s. However, you are able to give it as a for people with learning disabilities as kind of special considerations for that group. Because it's not licensed, you would need a PSD, so someone would need to prescribe it.
Okay. Next question is from Zoe. She says, can you clarify how long flu vaccines, the injections, can be left out of a fridge, for example, during a flu clinic?
The advice is they should be left in the fridge until they're used. So I know we do get queries about people wanting to leave some in a clinic room for a couple of hours. The guidance is that they need to stay in the fridge until they're used. There isn't a set period of time that it's okay to leave them out for.
Thank you. And the last question is from Angela. She says, there's one question from Jamita. She wants to know, if somebody turns 65 before March 2021, are we giving them the over 65s?
Yes, it's in the PGD, the details of it. If it is off-label, but there's something in the PGD that kind of clarifies that's acceptable to give under the PGD. But just double check your PGD wording, but it definitely mentions it in there.
And question from Angela. She says, am I right in thinking we can give QIVC to under 18s at risk if not wanting nasal?
So if they don't want the nasal and they are at risk, then yes, you can currently give the QIVC if they're over 9, or the QIVE if they're under 9. But if they're a healthy child, then that will be confirmed later in the season, because we're just prioritising the at-risk children first.
Thanks, Sarah. That's all the questions from Flo.
Brilliant. Okay, so if we go to the next slide, I'll talk about the cervical screening programme. Okay, next one. So big thank you again to everyone. I know a lot of practices stopped screening during COVID. Some people did carry on. There's a lot to catch up with, a lot of people who didn't attend. So thank you. And I know a lot of areas again are looking at innovative ways of working to try and catch up on some of these women that missed out during COVID. So some people are looking at doing screening over a PCN footprint, which is great. If that's something that you're thinking about doing, please get in touch with us and we can help you set it up and make sure that everything's in place for it. We've seen a big increase in samples at the lab compared to what we normally see this time of year. So compared to last year, we've seen about 200 to 300 more samples per week at the lab across Greater Manchester and about 800 more across the Northwest. So you're all working really hard to get these women in. So again, thank you very much. CSAS, who are the new administration service who send you invitations for cycle screening, they did pause invitations for a little while over COVID, but now they've caught up and they're inviting women on the normal schedule now. Can you go to the next slide, please? So just want to touch on rejected samples. So in Greater Manchester, we do have quite a high rates of rejection compared to elsewhere in the Northwest. So we're really trying to do some work to reduce these rejected samples, which can be rejected for a massive range of reasons. Create a lot more work for you in primary care because you then need to recall the woman back for screening after 3 months. But they're also it's not good for the woman to have to come back either. So we're really trying to work and work with you to support you in putting things in place to try and reduce these. So the two biggest things that we have normally are unlabelled vials and early repeats. So unlabelled vials, one of the things that we recommend is that if when you've seen a woman, just show her the vial before she leaves, ask her to check that her details are all right and that it's been labelled. That means that you've got someone else double checking for you. For early repeats, that's samples that are taken outside of the correct timescales. So we're waiting for updated guidance on this for the sample rejection, but currently any test taken more than 6 months early will be rejected. And if you are unsure, please contact us or use OpenX to check the history of the woman and see when her next test due date is. Just over COVID, we've had a massive number of samples that have been rejected due to out-of-date vials. So we've had about 130 samples rejected because the vials went out of date during COVID and they hadn't been checked. So please can ask that everyone goes back to the clinic rooms now and just double checks all your vials in all your clinic rooms, especially if it's a room you don't use very often, and just make sure you check in before you take the sample, because that's a lot of women that are going to have to come back. You need any advice or guidance, as it's a national programme, the guidelines are always the same across all the areas, so you can find the guidance online or you can contact us for any advice. And next slide. Finally, I just wanted to mention that testing. The preferred way of requesting screens through the ICE interop on your clinical system. If you work in an extended access service, then you can use the ICE desktop system. Using this, the electronic requesting really can reduce the number of samples that are rejected for things like mismatched labels and things like that. Some areas, the vast majority of people are using it, but it's a bit lower in other CCGs. So over the next couple of months, we're going to be contacting practices to see if there's any issues that they're struggling to use this, or maybe it's when locums are working, to help you implement it. But if you, again, do need any help, then please contact us and we can support you with that. Okay, next slide. I think that's it. Have we got any questions on cervical screening?
Hi, Sarah. Yes, we have some questions. Let me just get the chat up. Sorry, I'm flicking through stuff.
No, it's all right.
So Julie has, one of the questions from Julie, is it up to the colposcopy department to send the recall information to Open Exeter?
So if a woman's been discharged from colposcopy, then they colposcopy unit will send the discharge details to call and recall, who would then set their woman's next test due date. So yeah, if a woman's discharged from colposcopy, then CSAS, as they're called now, will update that on Open Exeter.
Okay, the next question is from Leanne. Who do we contact if we need more smear supplies?
If you need more vials, then contact the lab and they'll be able to sort that out for you.
Louise at Bury has asked, how do we get a login for the ICE desktop version?
I'm not sure how you request the logons. If anyone's got any kind of questions about that you're struggling to get on ICE, or you're not sure how to access it, if you drop us an email, and I will get some guidance for you on how to access it. Okay.
Kathy has asked, how early can we do 12-month repeats for HPV positive?
Again, I'm not sure because I only know the 6 months one, but I'll have a look in the guidance. If you could, again, just drop us an email with that query and we can find the guidance for you.
One of the other questions is from Julie. They've had problems with patients not being in line with Open Exeter.
If there's any, again, specific examples of something not being quite right or a date not being right, then do let us know and we can point you in the right direction of looking into it.
And lastly, Emily has asked, do you have any contacts for accessing smear courses?
I will get the contact details and I'll pop them in the chat.
Fab, that's all the questions. Thank you, Sarah.
Okay, great. Thank you very much.
Thank you, Sarah. That was excellent. Thank you. A really good update there. I'm sure everybody's pleased with both the flu agenda and the cervical cytology. We will answer those questions later and on the website as well. I'd like to introduce now Kerry Porter. Kerry's going to give us an exciting update on developments to support workforce development. Thank you, Kerry.
Hi everybody, it's really great to be able to join you today. So my name is Kerry Porter. I'm the Primary Care Workforce Programme Manager for GM. I work really closely with Leslie and get involved in lots of things concerning workforce. Karen, if you stop sharing and I'll share my screen and kind of talk people through. I'm going to put in the chat a link to the Primary Care Careers website. So hopefully you can all see that. Feel free to click on it yourself while you're sat at your desk and save favourites. And basically, after talking to newly qualified doctors, it became really apparent that there's lots of information out there, but it's really, really difficult to access it in one place. And so what we've been doing is trying to collect all the information and have it in one place, and this is going to be hosted on the GM Primary Care Careers website. Can I take you through this? So there's a section on here that's why work in primary care, why work in Greater Manchester and each of the boroughs. I will say that this website is evolving and that we would really appreciate your feedback. But in terms of our nursing colleagues, there's a whole section dedicated to nursing. So I'll take you through to that particular section. As you can see, there's a section on nursing roles. So depending on where you are within your career, there's lots of information, whether you're a healthcare assistant, whether you're a nurse associate, a GP assistant or a practice nurse, or even looking to become an advanced clinical practitioner. There's also information on the career pathway, what you need to do to get into nursing, as well as transitioning from one particular area of nursing into primary care. There's sections if you're an experienced nurse, if you're returning to nursing, and even what GM has to offer to you directly. So being a Greater Manchester nurse, which I'm sure you're all very familiar with, and also the leadership programme, which will be coming in the coming months, called the Care Support Programme. So there's lots of resource there. We really would appreciate your feedback. If you think something isn't appropriate or we're missing something, then by all means, please give us your feedback. There's also an education and training section, and I'd really like to draw your attention to something called the GM podcasts. So you might be familiar with this already, some of you might not. Basically, the podcasts are a free bite-sized educational podcast which you can download. It also attracts CPD points. There's all sorts of resources on there. Some were COVID related that happened and have lent themselves to the last couple of months. Some are linked to pathways and referrals, and some's just a general update. By all means, have a click on that and have a little look at what the information is retained in there. We are looking to develop over the next coming months some podcasts that are related directly to nurses. So kind of keep your eye out for that. It'll be really interesting and it'll be great to follow. I think what I'd also like to bring your attention to is, and we've kind of touched upon it this morning with Jenny, haven't we, around the health and wellbeing support offer for our nursing colleagues, recognising that actually the last couple of months have been really, really difficult. Oh, I've clicked on the wrong bit. Let me go back out of that. Some of the pages, as you'll just see, as a really good example, some of the pages are still under development and they're hidden in a wall. A good example of that is the dental pages and also some of the GP sections. We're waiting for those to be signed off. So let me, hopefully this will work. Let me click on the health and well, there we go, hooray. So this is the health and wellbeing support section that's specifically dedicated to nurses. So as you can see, there's nurse-specific sections in there that you can access, and also there's a whole breadth of NHS-wide services. I think we've already touched upon this morning in the chat about the section around our NHS people, and that will take you to the link that was in the chat today. It really is kind of worth having a little look around there to see if it's something that would be appropriate for you to access. So that's there as well for you. There's also a news section. So this is where there's any latest information, because what we really do recognise is that actually it's been really difficult communicating to practices and to practice staff. We recognise that the people get lots of information in their emails, and what then generally happens is that there's too much information to read so that you don't get the information that you do need. We're hoping that we'll be able to use the website so that we can just send you a link and that you can click on those links, or you can even subscribe so that you can get the information directly. We have an events page, and as you can see, we're all attending today the GM Primary Care Community Nurse Forum. So this events page will be used going forward for any useful update training or any events that we think you will find useful. The information will be contained in there. You'll automatically be able to copy it to your calendar, and you'll be able to click on to find more details on how to register. So like I say, this is a web page that is developing. We would appreciate if you would share it with staff that you work with, your practice managers, your business managers. There's lots of useful information. There's actually a jobs page. This job page automatically pulls through from NHS jobs, any job that's advertised that has a primary care within the heading. Or if your practice doesn't use NHS jobs, you can actually post a job directly just by filling out a simple template. So we've actually been working with newly qualified doctors to matchmake so that we can match them with practices across GM that have a vacancy. And in the coming months, we hope to do the same thing with our nursing colleagues by talking to those nurses that are about to qualify and try to attract them into primary care. Moira will be picking up on the offers that are available in the next presentation. But kind of Moira's information is also detailed within the website. So going back to the nursing roles, there is a section here that talks about locums. Probably not something that some of you would be interested in at the moment, but I'm going to stop sharing my slides and the website and allow Karen to reshare her slides whilst I move on and talk about the GM Workforce Bank. So you might be aware of this, you might not. Basically, Greater Manchester reached out to GPs, to anybody that had any clinical capacity at April time. There was a real fear that actually we wouldn't have the clinicians within the system as COVID hit. So we basically developed a GM Workforce Bank. It's in collaboration with a platform called Lantern. It's not a locum agency. It's basically a platform that hosts individuals that have clinical capacity and links them to practices that have sessions available. So we've extended the platform now to nurses, healthcare assistants, and we're about to extend it to train and upskill admin staff. If you have any clinical capacity and you want to work across GM, or you want to extend your skills to your own CCG area, can I suggest that you register with Lantern? It's a really straightforward process. You basically upload your CV, your DBS check, and your copy of your ID, which is your passport, for proof that you can work. Basically, then practices reach out into the bank. They present what sessions they need to be filled, and as a clinician, you can accept or express an interest in providing your clinical skills to that particular practice. Again, please share this information with your practice and your staff and kind of within your network, so we can share the message and get the information out there. I don't know if anybody's got any questions that they'd like answering.
There's no questions in the chat at the moment.
All right, brilliant, thank you. And I think that just about covers for me the topics that I wanted to present today. But by all means, do please have a look at the GM Careers website. As I say, not all the pages are live, but you should be able to click on the nursing section specifically. I can just see in the chat, so I'm gonna send the nursing section over.
I think some people can access it, but some people can't. I'm not sure why.
Oh, okay.
Does it matter
but I can look into that. It shouldn't matter which browser, but maybe if there's a block within your particular kind of system, maybe try Firefox. That might work better. But have a little play, and please feedback to us. If you think something's missing, then really welcome your feedback. It is an evolving website, so things will be updated, more information will be added, stuff that's out of date will be removed, etc. Yeah, I think that's it for me, Leslie.
Kerry, just before you,
sorry,
there is just one question that's from Anne asking if we've got any information on MSc funding.
So I'm not aware on, so there is the CPD funding that's available to all nurses and AHPs that you can use to apply to your own personal development. I'm not aware of any MSc funding specifically. There is funding around registered nurse upskilling, and I do note that I think Sam has got her hand up. I don't know if Sam's able to add to that. Certainly a question we can take away though, and see if there's anything else available out there. Sorry, Sam.
Sorry, thanks, Kerry. I thought it might be better if I fielded that. The MSc question was that around advanced practice. Specifically for advanced practice, there's typically funding annually through HE, which we'll get out probably through this this forum so that you can have sight of that. As Kerry's just said, there isn't typically funding for a full masters, but it may be that you could apply through one of the routes through the training hub for some part funding for some modules, so that you could then work your way up on that pathway. I think it might be worthwhile if I pop my email on the chat, if you want to just drop me an email about that, and we can pick it up outside and we can point you in the right direction, if that's okay.
Thanks for that, Sam. Thank you. Sam's our clinical lead for Greater Manchester Training Hub, so she'll be she'll answer all those questions for you. Thanks, Sam. Thanks very much, Kerry. That was superb. So 2 really exciting things there that we've got going at GM for us all to get onto and have a look at and get involved with. Some really exciting developments, and that platform will get bigger and bigger. So a good repository there to link back for further information. Our next guest, I'm really pleased to say, is Tracy Hart. Tracy's a quality manager from Greater Manchester Health and Social Care, and she's discussing learning disabilities today. Thank you, Tracy.
Thank you, Leslie. Hi, everyone. Thanks for asking me today. I'm really conscious I've only got 10 minutes for a subject area that's potentially huge, really. So I'll try and be really quick, but I just want to take the opportunity to really update you about what's going on in Greater Manchester and really get your feedback at how we can support you further going forward, really, because I'm really conscious that learning disabilities particularly is quite a specialist area, and I consider it to be one of the widest health inequalities that kind of do exist, really, which I'll go through the slides and that'll become more apparent, really. Just a bit of background, we've kind of known about the health inequalities those with the learning disabilities do face through other kind of research that's been had, but we know even more now because we do letter reviews on everyone that dies. Just to give a little update, so in Greater Manchester, learning disability strategy was launched last year, and that is written by those with a learning disability, and there's 12 pillars for that, for which good health is one pillar. Now I can send you a copy of the learning disability strategy if you've not already got that. If you don't mind going on to the next slide, please. Just a little bit about the LEDA programme. I don't know if you've all heard of the LEDA programme, but the LEDA programme was launched 2 years ago, and it's a first national programme aimed at making improvement to the lives of people with a learning disability. It does this by looking at why people die with a learning disability. So everybody with a learning disability who dies, we ask for them to be referred to the LEDA programme. This is a programme that's led by CCGs, and in Greater Manchester already we've reviewed around 580 deaths. So we've got a really good insight now, even more so, into why people in Greater Manchester are dying earlier from a learning disability. If you don't mind going on to the next slide, please. Just a little bit about the LEDA programme, the Learning Disabilities programme. It's not about looking at blame in any way, but it's really around looking at any learning and recommendations that come out of that, really. This slide here, I think, is quite pivotal, really, because if you can see there, people with a learning disability are more likely to die under 65 years old. The average age for the death of a female with a learning disability is 59 years, and the average age for male is 61 years. So that's around 22 years and 25 years behind the general population. So massive, stark health inequalities underpinning this, really. If you don't mind going on to the next slide, please. This slide here is just really around demonstrating that obviously learning disabilities are often categorised into mild, moderate, severe and profound and multiple. Often we see that those with quite profound learning disabilities, as you can see here, die often in the first 25 years of life, which is massive. So really, that the more profound a learning disability, the findings we're getting back, and we've had back in Greater Manchester is they're more likely to die very prematurely compared to the rest of the population even more. Also, when we've reviewed all the deaths, it's quite common for someone with a learning disability to have up to 6 or 7 what we call comorbidities, and that might mean diabetes, obesity, asthma, circulation. So they've got a significant amount of comorbidities, and also they're taking 6, 7, 8, as you probably know, additional medications on top of that. So often, as well as a learning disability, they've got quite severe, profound health needs on top of that. Next slide, please. Here are the most common causes of death in a learning disability. So when we've reviewed these from a national perspective, and in GM, overwhelmingly our main cause of death in GM is bacterial pneumonia and respiratory infection. So I'll come on to, Sarah touched on the flu, so hence the importance of flu vaccination. Also aspirational pneumonia, but also dementia, Alzheimer's disease. We've got sepsis there. We've got epilepsy there. We've also got a lot of, underneath there, a lot of other reasons why someone with a learning disability has died, and they could include things like constipation, cancer, obesity, and extensive other comorbidities. And I think it's quite stark that some of the reviews have come back that someone with a learning disability has actually died of constipation, which, you know, we wouldn't necessarily see that in the general population going forward. So as we see there, so in a learning disability, respiratory is our highest cause of death in someone with a learning disability. In the general population, that's around third really. But we learned through COVID as well that those with a learning disability are very prone to respiratory distress and subsequent mortality on the back of that. So I'll come on to that a little bit more going forward. Next slide, please. Here it just demonstrates around avoidable mortality, treatable mortality and preventable mortality. And like I said, the LEDA programme isn't about blame, but I've put this slide in here because it really does demonstrate that when a lot of the learning that's come back from the LEDA reviews compared to the rest of the population, some of the deaths could have been prevented or treated or avoidable if captured, what we call a little bit earlier really. Next slide, please. Some of the findings that we're getting why people are dying earlier, often it's delays in the diagnosis and treatment of illness. We know some people with a learning disabilities, they don't access cancer screenings as readily as the general population. They don't access preventative appointments as easy as the general. So often the finding reviews that people just weren't presenting going forward to have any kind of public health intervention or when they're getting symptoms, any early diagnosis in that. Also poor care coordination and communication between agencies was quite stark really. We found when we looked at the deaths of those with the learning disabilities that there was sometimes a lack of communication between a lot of the agencies, and I do think that is sometimes quite complex because often there's multiple people involved in care of these going forward, but in some cases I think they'd probably benefit from more key workers going forward, and that's obviously part of one of the recommendations as well. But admissions in care or the provision of substandard care came out as well, but also application around the Mental Capacity Act wasn't always used, and best interest decisions weren't always used or used incorrectly as well. So there's quite a bit of training that we need to do around that. But lack of timely referral to specialists, including learning disability services and neurologists really, and there's a potential of masking and maybe clinical overshadowing of someone with a learning disability and not fully knowing about what their real issues might be on the back of that. And also that there was no reasonable adjustments made in any circumstances as well going forward. Next slide, please. So the priorities going forward in the long-term plan and the NHS response, but also the priorities in Greater Manchester in our learning disability strategy around a recovery and restoration of annual health checks. And I think this is really one of the most important elements for an individual with a learning disability going forward. And that means having a thorough annual health check and a really good learning disability plan with named individuals that comes from that really. And that would also identify any comorbidities and who is potentially responsible for doing this. Also, the learning disability register needs to be up to date. What we found is there's only about 25% of people on the learning disability register. So obviously, if someone isn't on a learning disability register, they're not potentially called for things like the flu vaccination or treatments going forward. So there's quite a lot of work with NHS Digital around coding and correct coding going forward on the learning disability register. And I suppose the question back to you is how further can we or the system support practices with that as well going forward. Also around stamp and stomp, we found through the reviews that often people were prescribed psychotic medications, often for the wrong reasons. So 25% of those with a learning disability were on a psychotic medication, not for the initial reason they were prescribed it. So often started in secondary services, but carried on in primary services rightly in a lot of cases, but in some cases we found that they're often on more than one psychotic medication when the NICE guidance is actually on. So there's something there around if someone is on long-term medication to make sure that someone with a learning disability does have regular reviews on that. Also, the priorities were around actions from rapid reviews and led learning. When it was the height of COVID, there was we did quite a significant amount of reviews on those people that had unfortunately died of coronavirus at that time. We found our rates of referral to the LEDA programme went up quite significantly in March and April time because of COVID. What's come out of the reviews is that, and this is probably not any news to you at all, that those with the learning disabilities are more susceptible to the severe effects of COVID. Also, that someone with a learning disability may not initially present with the same signs and symptoms as someone in the general population with COVID as well going forward. And in many cases, by the time someone with a learning disability presented in A&E, they had quite severe silent hypoxia, and they think that's around how communication happens at that point, really, and basically the difficulties in communication as well. I've just put there as well, I suppose with someone with a learning disability, it's about thinking about what reasonable adjustments that we can make so they can access treatment and care as in the general population, really. And that's really thinking about how we write to them, how letters go out. Someone with a learning disability will always need easy read information, and they've done quite a bit of in-depth discussion around this factor with someone with a learning disabilities. And often when they don't get something in an easy read, they do get very distressed and anxious about that, and then it actually puts them off attending for any treatment or appointments or whatever going forward. Also, a priority this year is around having the flu vaccination as well. So obviously Sarah touched on that, and it's really thinking about how we can tailor services to those with a learning disability, and looking at how our clinics are run, because often someone with a learning disability won't want to sit in a busy waiting room, and we need to just really think about what reasonable adjustments we might put in place for those as well going forward. And that's easy read, and I know Sarah touched on it. Obviously injectable is the first line of vaccination for this group because of the higher efficacy. But if someone does need a reasonable adjustment, then a nasal flu vaccine can be part of that as a reasonable adjustment going forward. Next slide, please. And I always think learning disabilities can be quite a specialist area as well going forward. So I suppose it's just around thinking and feedback from yourselves how you feel that the system can further support primary care going forward. So we've got obviously community learning disability teams in every locality, and their model of working is often where they are attached or affiliated or do have responsible GP practices and primary care practices that they can work towards supporting as well going forward. And like I said, I do think, you know, people study 3 years to study learning disability nursing, so I think it's really tapping into that expertise around reasonable adjustments, around the Mental Capacity Act, around best interest, around how we tailor our services more to support those with the learning disabilities. A learning disability flu toolkit was produced by Sarah's team, the Screening and IMS team, and we can resend you that if you've not already had that. There's also been an annual health check resource pack produced. I think we really and I think everyone really understands that obviously in the current climate with COVID, it's how we can really carry out these same things, doing things a bit differently, and it's what the new normal is, because in many circumstances someone with a learning disability might not have technology to do a Zoom call or whatever as well, really. So it's really thinking about how we can carry out these things in the new normal going forward. So like I said, there's an annual health check resource produced pack comes out that starts some way to looking at that. There's also a webinar, and I can send Leslie the details of that around annual health check webinar going forward. Learning disabilities annual health checks and learning disability register was in the QOF improvement module from last April to this April, and I just think it's a bit unfortunate we've had COVID and it's potentially hindered that as well, because you've had so many other priorities to contend with. So we need to just find out if that's going to be extended as well going forward. And I probably ask you as a group, if there's any further support that you feel you need, I'm happy to try and get that for you in the best way I can, because I understand how busy you are, but also potentially the complexities that you're also having to contend with around this. So happy for any questions. And in some ways, I kind of feel it's potentially just the start of this discussion as well going forward with learning disabilities around how we can work together more closely with primary care. Thank you. That's it, done. Thank you.
Thanks,
Tracy.
Oh, sorry, just going to go to questions, Leslie.
Thanks.
So sorry, I'm just bringing the questions up for you, Tracy. It's pinging. Could you send links out for the Garton and Levenshulme Community LD team, please, so people don't have them?
Yeah, okay. I can do. Yeah. I think there's quite a few questions there, wasn't there? So I can read some of those and send whatever's needed, really. Yes, I've got that, thanks.
Tracy, are you reading the questions, or do you want me to read them out?
Oh, sorry, Liz, if you don't mind just reading them out, please. Sorry.
Yeah. So Margaret has asked she would like a robust and appropriate template for LD annual health checks to be available to people on EMIS. Is that possible? Yes, it is possible. I do believe there is a national template now that's come out that's fit for purpose with EMIS. But yeah, that is possible. Yes. Okay, next question is from Angela. She said a webinar dedicated to the LD annual reviews would be great.
Yeah, I can send you details of that through. There is one, I can go via you, Leslie. There's one organised, I think, for November the 3rd as well. So yeah, absolutely.
Okay.
Yes, I think there's a template for System 1 as well that is just finishing the development stage, I do believe.
Fab. So the next question is from Cynthia, and she said, how do we get hold of the LD resources pack?
I can send those via you, Leslie. You happy if I send them to you to distribute to everybody? Make sure everybody's got them.
Yeah, we can put them on the website, Tracy, and then everybody can link that way. Yeah.
There's a lot of people asking for the links for the LD teams across GM. So is it possible that we can just get the links for all of them and add them to the minutes of this? That would be great if possible.
Yeah, that's fine.
Yeah, Margaret will get the resource packs out. Same for Jackie. But yeah, that's all the questions. Thank you, Tracy.
Thank you very much, everyone.
Thanks very much, Tracy. Some thought-provoking information and data there for us all to take back, isn't there, and do something about it, I think, to reflect on. Yeah.
I do have a question for Tracy. It seems like you've missed mine. Sorry. I'm just, it's fine. I'm just thinking, we have a lot of patients who we struggle to obtain bloods from, especially for the medication side of it, for the monitoring of the medication. And obviously we are finding it very difficult with our, obviously with our pharmacist who looks at these and wants us to do reviews on these patients, but these patients obviously are inaccessible for bloods for us. So we are struggling at the moment with that. Is there any?
Appreciate that. Yeah, in some, what area are you, please?
HMR.
HMR, yeah. Have you engaged? I mean, I can have a separate discussion as well outside of it, but in some areas they've had to go down. They've had to create kind of general anaesthetic pathways actually to do all these. I'm not for a minute suggesting that, but
no,
often,
I understand.
Yeah,
we have had areas. We have had patients who have been sedated for us to go to. Some are quite aggressive, and then others we obviously, especially with COVID and being safety wise, we can't attend their houses without PPE, and they won't accept us with face-to-face PPE because it scares them, but it's unsafe for us to go without PPE. So we're really stuck on both sides, the sedation side and and
I think you've raised a really valid question, very complex, quite conscious of the time. Can I pick up with you outside of here, because I can have some discussions with the teams over there and maybe look at how you can be supported around that, if that.
Yeah, I mean that would be great. That it's just it is. We do have quite a few patients who we can't access for bloods, and their medication their monitoring for the medication is getting wider now since the COVID.
Absolutely.
And some we can't get at all, full stop, and that's obviously quite a concern, especially given the medication that they need and the monitoring that they require.
Absolutely, and I think you've raised a really good point there. Yeah.
Sorry, ladies, can we move on? I'm sorry, we need to move on. Thank you. Thanks, Julie. Yeah, we'll answer all the questions that come up in the chat. Everybody will be answered. Thank you.
I'll leave if you can just message me on email, Tracy.
I'll put my email address on this now.
Okay. Yeah.
Thank you.
Thank you.
Sorry about that, everybody. We'll move on to our next speaker, who is Moira. Moira is a clinical educator from Greater Manchester Training Hub, and she's going to discuss the new bespoke preceptorship course for general practice nurses in Manchester. Thank you, Moira.
Thanks, Leslie. Hi, me today. My name's Moira Ogan-Sarkin, and I'm the lead nurse educator for the Greater Manchester Training Hub and Selfreferral Primary Care Academy. Can we have the next slide, please? I'll do a whistle top to catch up with time. So I've been asked along today to give you an overview of our programme, which is the GPN New to Practice programme that we're running across Greater Manchester for newly qualified nurses and nurses new into practice within the last 12 months. So just to give you a little bit of background how we came to develop the programme, About 4 years ago, we sat on a lounge floor with bacon butties and cups of tea in hand and post-it notes. And 4 of us put together everything we thought a GPN needed to know to allow them to work effectively. We knew from listening to lots of nurses that some training was ad hoc and for some no training was being given at all. So we put together our ideas and off we went with our post-it notes on a flip chart paper, and we approached the University of Salford with our idea. We were then lucky enough to get some funding to trial a small cohort of 10 from Salford CCG. Fast forward to 12 months ago, when we started with the first cohort of 20 nurses from Greater Manchester. News travelled fast and soon we were joined with another 10. They have just finished the course, slightly delayed due to something called COVID, but nothing stops a good practice nurse. And the best news for Greater Manchester nurses is that we've managed to find funding for 60 nurses this year on the new courses. Can we have the next slide, please? So what is the offer? Well, here it is in a nutshell. It's a bespoke, fully funded course that covers all the costings, including cytology training, IMS and VAX training, and all the long-term conditions. We have up to 30 places for nurses new into practice within the last 12 months on the 1-year preceptorship programme. So this is for nurses that come from secondary care, district nursing, return to practice, and they require upskilling with the general practice nurse skills. We also have up to 30 places on the 2-year fellowship programme, and this is for nurses that have just completed the nurse training within the last 12 months. So we've got 60 places split between 3 cohorts of 20. The first cohort bravely started 2 weeks ago, so well done, some are on today, watching us now. The next one starts on the 20th of January 2021, and the final one June 2021. So we're hoping this rolling programme will allow us to pick up nurses that are employed in the coming months into general practice across Greater Manchester. The offer also includes backfill money for 1 session a week for 30 weeks of £100 per week. Can we have the next slide, please? So what is the preceptorship programme? It's 1 day a week for 30 weeks. Now, this is mainly done via webinar at the moment due to COVID, but we will be reviewing it as the course progresses, and we will be having some small face-to-face meetings with social distance measures taken into account. Ideally, each nurse will have an in-house mentor, but for those that struggle, we would look to provide external support via a neighbouring practice. For cytology training, we will include training for cytology mentors in the programme. So this is a great offer as we'll increase numbers of cytology mentors across Greater Manchester. Assessors will be external as required by the University of Salford to maintain the standards of marking and for accreditation purposes. And the even better news for us that when the QNI, the Queen's Nursing Institute, published the Education and Practice for Nurses New to General Practice Nurse document in May 2020, we were following the syllabus completely, so breathed a sigh of relief. Next slide, please. So for those on the fellowship programme, and this is nurses that have qualified in the last 12 months, they will do the first year preceptorship programme and then go on to the second year, which includes the following modules: further development of population health, leadership, management, QI, mentorship, coaching and education skills. And this is just being developed as we speak and links into a pathway for continuing education and development. So as they say in all the good books, watch this space. Next slide, please. Oops. So this is what's included in the programme. And as you can see, everything we could think of included the dreaded CQC inspection, infection control, group consultation and working within the pandemic. Obviously, this list is too long to read out, so the slides will be available afterwards for you to read. Next slide, please. So here's the September's first term's timetable that have just started. And as you can see, they've hit the ground running as we're aware of how busy general practice surgeries are. Straight away, we have the respiratory modules, which include asthma and COPD, and this covers everything from pharmacology, nursing assessments, management, local and national guidelines, and the QOF indicators. IMS and VAX training, ready for flu season and baby clinic, cardiovascular disease, diabetes, and then we start cytology. So they get used to the OSCEs at the end. We do include team presentations for them. This allows them to gain experience and confidence. There's also case studies that they will need to be involved in, and also revision sessions so they can consolidate the knowledge they've gained within the last term. Next slide, please. Assessment-wise, this will be done by the PAD document they'll be given, and the mentors sign off competencies as they complete them. They are also given an extra 6 months to get this completed. Then they present this document to the assessors for it to be quality assured. They also have presentation assessments and finally OSCE scenarios. The marks are then sent to the University of Salford to be verified. So I can assure you no bribes are taken, although Dawn and I do like a good pie or two. On to the next slide, please. So here's the end results of the training. This is last year's lovely cohort, and they all seem to have survived without too many battle scars. It was tough going at times as we hadn't factored in COVID, but with a few changes to the curriculum, we managed to finish just a few weeks later than we expected. Next slide. At the end of the course, we did ask them for some feedback. So I've just highlighted a couple. As you can see, this is just one. And then if we go on to the next one, the feedback was all very similar. In a nutshell, they loved it. And we're going on to our final slide now, I think. So I'm leaving you some final words from two of the lounge floor crew. Kate and Jill, along with Dawn O'Brien and myself, were the bacon butty crew and are to blame for this course. So if you know of any practices that are taking on new nurses, then email the generic email address on the slides at the end with any questions or from the application form. There's still places available for 2021. And to make it fair, we have tried to ensure that all CCG areas have similar amounts of places if needed. So many thanks for listening to me today. I have stopped it so we could catch up a little bit on time, and I'm happy to take any questions. Thank you.
Hi, Moira. One of the questions we have is from Megan. How do we apply to the preceptorship programme, please?
Right, this can be done either via your CCG lead nurse, or you can email at the end of the slides, the next slide, there is an email address. So if you want to email us, we can send you the application form and the slides are available at the end. But I'm happy to pick up any questions and I can put my email address in. Thanks, Dawn.
Thanks, Moira. That's all the. Oh, sorry. Maria has asked, are there any HCA courses being planned? Oh, Moira,
Maria, and Dawn is probably the better one to tell you about that.
Yeah, we're very short of time today, but we will be sending out information.
Yeah, sorry.
HCA. Last question, sorry, Moira. In practice, does this require a supervisor and assessor for the student?
No, it doesn't. No, we just need a mentor. So that could be another nurse, it could be a GP. And if there's not another nurse or GP on site, we can provide an external one. Thanks, Dawn. Thank you, everybody.
Thanks, Moira.
Thanks, Moira. Superb presentation there. What an opportunity for our new nurses coming into general practice. All the information and any questions that we've been asked today will be answered and will be made available on the careers website for you to read. So thank you again, Moira, for that. That's really good. We are a little bit behind time, so really all I've got to say is, I'll just put my camera back on so you can see me speaking, is to say thank you once again for joining us. Thank you to our speakers as well, and I'm sure you agree there's been some really interesting updates and information sharing today. And like I said, a recording of the forum will be placed on the website alongside the answers to today's questions for everybody to see. And that just leaves me with one final request, and that's called a snowball exercise. Usually this is done in a physical space when you're at a meeting, where everybody would put down anonymous feedback onto a piece and then throw it up in the air for somebody else to catch and go away with. Well, today we can't do that paper exercise, but we'll do it as a virtual exercise. So what we're asking for you to do in the chat box shortly will be to put your feedback in, or give suggestions, comments, or a reflection from today's meeting that you're going to take away with you. Type it into the chat box when I ask you to, and then when I ask you to press send, if you don't mind. So all the chat from that will be collated and collected, and will be presented back to you via the GM website. So thank you once again for joining us. And if you want to type your chat in now, I'll give you a few minutes. And if you can press send now, thank you. That's great. Keep them coming. Superb. Thank you so much for that. Thank you very much. We'll log off at 1:30. Thank you. Please keep posting your suggestions, telling us what you'd like at this forum.
Leslie, I think we're just waiting for people to still leave. It looks like.
Yeah, that's fine, Dawn. No problem.
Thanks, Leslie. It was a really good meeting.
Excellent. Yeah. Hey, will you stop recording, Kat?
Let me just get other people to leave.
Yeah.